It's an absolute pleasure now to introduce Dr. Adrian Massey, a consultant occupational physician who has worked in medical practice for 23 years and is the renowned author of Sick Note Britain. As well as working as the Deputy Chief Medical Officer at Health Partners, Adrian is also the Trust's Chief Medical Advisor. Health equals wealth, yet truly understanding the relationship between a fit and a healthy workforce and financial performance in an ever-changing crisis has never been harder. Adrian will lift the lid on what every people leader must know about the health of their teams.
Good afternoon, everybody. I'm Adrian Massey. I'm an occupational physician with an interest in relationships between health and work. It's a pleasure to talk to you this afternoon. I'm going to be talking about the role of business and of business leaders in improving employee well-being. So we're going to begin by talking a little about the interactions between health and work, which are very profound. We'll talk about the ways in which employers can use work and use the workplace as a means of improving employee well-being, evidence-based approaches which we know to be effective. We'll talk a little, of course, about the incredible challenges posed by the coronavirus pandemic to those efforts, and also about the particular challenges posed to the retail sector in particular. And then I'll finish by pulling out what I think are really the main themes, the guiding principles that any employer should be using as part of their well-being strategy. So, work and health first of all. Real interest in the relationships between the two took off, I would say, probably about 15-20 years ago with the health, work and well-being strategy, and that marked the beginning of a number of landmark studies looking for the evidence base to prove what we'd always believed, which was that work was a key determinant of people's health. And the evidence is very strong and compelling. So we know that people who are out of work for long periods of time tend to experience significantly poorer scores and outcomes of physical and mental health. Rates of mental illness are higher, so anxiety, depression, rates of alcohol and substance misuse, cardiovascular disease, premature death, social isolation, loss of social mobility, and so on. And these effects are so deep, so profound amongst a community that they can even be intergenerational. And if you look at mining towns, for example, where there was a rapid transition in the economy, many jobs ceasing to exist over a relatively short period of time, what we've seen is that those adverse health effects ripple through to the next generation and even the generation beyond that. So it's clear that work as a determinant of health in our society is crucial. And when we're thinking about the role that businesses have to play in improving the lives of people in our society, and of course first and foremost their employees, I think it's often overlooked that actually the offer of work in the first place is an incredibly important role in society. You know, people who start businesses, entrepreneurs, business owners, risk their capital. They put everything on the line to be able to offer opportunities for employment to people, often in a situation where the legal backdrop to that, the regulatory burden, has become really quite high over successive decades. The compliance costs, the barriers to entry can really be sizable. So I don't think we do enough to celebrate the role of entrepreneurs and business creators in our communities merely for the fact that they create opportunities for employment, because as we've just seen, that's an incredibly important part of improving people's health and well-being. Now, what about beyond that? So what about beyond the mere offer of employment, the things that can be done within someone's employment to improve their well-being? And I guess to what extent is that something that should be a concern to business owners? Well, if you were to take a particularly hawkish view on that, I guess the best example would be Milton Friedman, famous economist, who in the 1970s espoused what has come to be known as the Friedman Doctrine, which was really a very narrow and economically defined vision of what business existed for. So Friedman really articulated the idea that the role of business was simply to play the game being to generate profits and returns for shareholders to the best of its ability within the legal constraints at the time, but beyond that it had no wider purpose, no wider social role. And that was best challenged in the late 70s by Kenneth Mason, who was president of Quaker Oats at the time. And he wrote, "What a dreary and demeaning view of the role of business and business leaders in our society. making a profit is no more the purpose of a corporation than getting enough to eat is the purpose of life. And I think those are very wise words, and they're reminiscent of what many of us would recognise as this triangle, this pyramid of ascending needs that we all have as human beings, which is Maslow's hierarchy of needs. So Maslow being a psychologist who articulated this idea that human beings have got needs but on different levels, and they begin at a very primitive stage with the things that we just need for our sheer survival, our subsistence needs, but be it food, be it water, be it shelter, warmth, that kind of thing. But of course, human life is much richer than that. It's about much more than mere survival. And as you escalate up the different tiers of the pyramid, he talked about safety needs, about love and belonging, the need to be recognised and included and valued in our society, to have our role to play, and ultimately from that deriving what he called esteem and then self-actualisation. So this concept that we have some meaning in our lives, we have some sense of defining purpose that makes it a life well lived. And I think Kenneth Mason was getting at the idea, and I've mentioned already, that corporations are composed of individuals, that what's true for individuals is, I believe, true for corporations. People want more than mere subsistence. They want more than mere profit and return on investment. Now, that's not a naive conceptualization of business. Of course, just as we need our basic physical needs met before we're able to achieve those higher goals, the same is true for business. You need to be profitable. You need to have a dependable revenue stream to be able to go on and do those more aspirant things in society. But that's what we want our businesses, and that's what we want the role of employment to be. If you look at the role of shareholder interest, engaged shareholders' revolts, shareholder action around companies that they believe aren't acting in accordance with an environmental, social governance agenda that they're in favour of. If you look at customers, the rise of consumer activism over the years, people actually using the behaviour of corporates as a means of their choices as to where they spend their money, and of course for individuals. And I think, in danger of generalising, many employers would recognise that particularly the millennial generation, perhaps more than any other, tend to be motivated by things that are much wider and much more perhaps aspirational and immaterial than sheer pay and rations that come with the role. So of course we don't live to eat, we eat to live, and we should hope that the role of business can be far wider than mere return of value for shareholders. So let's look at the role of employers with well-being, and I really want to hammer home this business case as to why employers should be focused on this as never before. I've said already there's an argument, a moral argument relating to human dignity, what it means to be a human being, that when we offer people employment in the workplaces we create, they should be more than just mere transaction. It should be about enriching people's lives. So there's a moral case to do it. And I've mentioned in passing the regulatory burden, the compliance burden on employers, which has become huge over the years, and there is an increasing interest from the lawyers and in the employment tribunals in the behaviours of employers towards their employees, and ever greater expectations as to the care with which they should be treated. And then, of course, there's the commercial imperative, the environmental, social governance agenda. I'm well aware in my day-to-day work that those employers who are deemed culpable as having caused significant harm to their employees, for example, that can have a material effect on a company's share price. And then the self-evident argument that even if in normal times there was really little ability to tolerate sickness absence or reduced productivity, poor engagement from staff who are struggling with health problems, I think we'd all agree that in the current environment that imperative has been like never before. So using the workplace as a means of improving well-being is something that we should be doing, it's something that we must be doing, and it's something that we simply have no choice to do. I introduce at this stage the idea that many employers miss a trick when they're thinking about these things and beginning to devise a strategy as to how they can improve well-being in their organisation, in that they don't refer to their brand, which is strange because if you think of the time and money and investment put in developing a brand, developing brand values, they're nearly always the ideal starting platform to be developing a well-being agenda from. Now, looking at the particular things that an employer can do to achieve this goal of improving well-being for people, it's helpful to think in terms of primary, secondary and tertiary intervention. This is a common framework used in healthcare when we're thinking about the ways any harm can be reduced. And of course, prevention is better than cure, and the first tier of prevention, primary prevention, is trying to create an environment in which problems don't arise in the first place. And then escalating up to more reactive interventions, secondary intervention being where you may begin to address problems where they seem to be emerging, tertiary intervention being treating, attempting to mitigate a problem once it's occurred. And the danger, I think, when we talk about well-being is we naturally move towards medical interventions, healthcare interventions, be it counselling, psychotherapy, physiotherapy, any number of modalities. And of course those things have a place. I wouldn't be in healthcare and I wouldn't be practicing as a doctor if I didn't believe that medicine and healthcare had a role to play in addressing health issues. It certainly does. It's just that by and large we are missing a trick if that's where we immediately direct our attention. For one thing, interventions are fairly expensive, and we've already talked about the economic challenges that we're facing. And for another, they're not all that. You know, the evidence base of many interventions in terms of their ability to keep people in work and get people back to work when they've fallen out of work is in some regards disappointing. It exists, but it's not as strong as we would like. And overwhelmingly, the levers which employers have to pull, which are cost efficient and effective, relate to the quality of the relationship and the interactions between line managers and their teams. That's an absolutely crucial point to understand, because that's where you get bang for your buck. If you have line managers who can form quality, enduring, consistent relationships with their teams where there's care and a team approach is being fostered towards the conduct of business, that pays off immensely in the longer term. And I shall come back to that towards the end as to what I mean by that. Now, challenges posed by the COVID environment. Well, unfortunately, many of the things that we know are determinant of people's health, you know, all the health messages that we're all familiar with around alcohol, around getting exercise and so on, around having strong personal relationships in our lives, they are fraying at the edges during a very difficult time for many people. Indications are that alcohol consumption probably has increased. A lot of the on-trade consumption, which decreased during lockdown and has restricted pub opening hours, has probably been more than compensated by alcohol consumption in the home. There's a significant increase in domestic violence calls to the emergency services, and measures of loneliness, so taking self-rated scores of loneliness pre and post-lockdown, show that it's really had a very profound impact on people. And we're also beginning to see health effects and harms caused, not directly related to COVID, but by the non-availability of a normally functioning health service during this period. There's a lot of concern about delayed cancer diagnoses and cancer deaths that would have been avoidable in normal circumstances. The same is true for cardiovascular disease, and the same is true for orthopedic problems, people awaiting hip, knee replacements, maybe simple keyhole interventions that would be the difference between them being able to get up and get back to work and not. This slide I'm showing now is data that's come from the company that I work for, a large occupational health provider, looking at the type of cases that were referred to us during the first few months of the pandemic during lockdown. And what we saw early on was a significant increase in the proportion of mental health referrals. And I think anecdotally we would also say that we've seen an increase in the severity of those problems, a great deal more calls relating to suicide and safeguarding concerns. And then as the pandemic evolved, we saw a gradual increase in the kind of miscellaneous category of health problems that aren't normally a significant proportion of the work of an OH provider. You know, traditionally we see mental health, we see musculoskeletal, and we see a smattering of other bits and pieces, but it rarely is, you know, the main body of work that we see. And that's changed, and I think that is the non-COVID morbidity, you know, the people with health problems that are not being catered for while the health service has been knocked for six. And that's clearly of concern because the backlog of disease and illness and ill health which is accumulating in society doesn't show any sign of dissipating soon. And that's partly because the capacity of the health service is going to be challenged for a long time to come by the infection control procedures that are going to be necessary for the foreseeable future. And then, of course, if we look at it from a fiscal level, the impact of the economy and on tax revenues means that the actual availability of funding for public services, health service included, is going to be be a real challenge in the coming years. Now, what about retail in particular? Why does retail face particular challenges? Well, I think first of all, the sector was already being disrupted pre-COVID. So the gradual move to online, this inevitable flux in any economy where jobs need to move, sectors need to reshape and reform. And of course, COVID has accelerated that at a rate which is likely just to be too quick for us to react to. The movement of capital being so much quicker than the movement of labour. And unfortunately, that means that we're likely to see large, high levels of joblessness in the months and years to come. And I've already begun by talking to you about all the health effects that is unfortunately likely to have. Then there are demographic factors. Many people self-select into retail roles because the flexibility in terms of hours worked and shifts worked can be really helpful to them if they have caring responsibilities, homemaking roles, and especially that sandwich generation that we talk about, with generations either side of them needing their help. So they're people who are already struggling to make ends meet and for whom this period is going to be especially difficult. And of course, the other point is, in many sectors, the move to home working has been easily accommodated. It's just working in an office in your back bedroom to working in the office in a town centre isn't vastly different. And that's rarely true in retail. Retail workers need to get into work, meaning they need to travel on public transport with all the worries that will have with it. Depending on the physical environment of where they're working, social distancing may or may not be especially feasible. And I've mentioned already the social tensions, the kind of fraying of relationships between people in society, which I think is going to already have an effect on retail workers, because of course they're day-to-day dealing with the public as the core part of their role. So I'll finish for these last few minutes with what I think are the guiding principles that should really determine any organisation's well-being plan. The first thing to realise is it's largely in your hands, which is good news, because you don't need to pay for costly external interventions to achieve the changes that you want. It's nearly overwhelmingly related to the way in which your line managers interact their teams and deal with them. So I think that should cause some consideration, some reflection on to what extent the line managers in the organisation get selected on those soft skills, on the emotional intelligence which is needed to form those strong relationships, and to what extent is it based on either technical experience of the role, technical capacity, or indeed length of tenure. So organisations, I think, have got to start paying attention to those characteristics, those soft skills, the emotional intelligence, being both a selection criteria for managers and something that's part of training, development, appraisal, promotion, and so on. And then you need to create an environment in which managers who've got that skill set are empowered to manage. And that's very difficult to achieve in organisations which are hugely policy-led. Policy is anathema to people exercising discretion and judgment at a local level as to how they think a situation should best be addressed. So giving those managers the latitude to be empowered to have conversations with employees and to make decisions as to what's the best balance for them and for the business is key. And I think my concern about well-being is that the wellbeing agenda is that I think in some organisations there is an ambiguity as to exactly what the manager's role is. So this tension between the operational aspect of their role, the delivery of their role, and the well-being role on the other. And I think when there is that ambiguity, the problem is that human nature being what it is, the manager will tend to disengage. Because why would you open a conversation with someone when you're not confident what you're going to do with the answer? So I would really encourage that you have a culture where your values are lived, where it's clear, a shared set of objectives, a shared set of values and behaviours, where the manager knows. Because that may be quite a tough message. It may be that actually the capacity to accommodate people's needs is pretty limited. But at least if you have managers that recognise that and understand that, they're not going to be scared to have the conversations with people which help them to at least establish what can be done and what can be agreed. And the mere fact that you have those engaging managers and are having those conversations will go in a huge way to building the resilience, building well-being in the organisation, and in turn attendance, productivity, all those good things. So they're really my key messages to you. I think retail trust is an incredibly valuable resource, a whole suite of resources available which will help facilitate that upskilling of managers and as practical tools for them and for their staff. And I think my final message would just be that these are tough times, but they will not last forever. COVID, like all things, shall pass, and we shall get to a future which looks brighter than the situation does at the moment. And that's an important message. It's a very human message. And again, I think that's a sense and that feeling of hope is something that in any organisation that's going to weather this period, that really needs to be remembered, borne in mind, and reflected to one another, because we're all going to need each other during this period. Thank you very much.